Hello and welcome. If you're new here, I'm the UK Diabetic Guy and I live with type 2 diabetes. I talk about it openly and try to explain what the condition is without fear, judgment or confusing medical jargon. Today we're answering a really big question. What actually is type 2 diabetes? Type 2 diabetes is a condition where your body struggles to control the level of sugar or glucose in your blood. Glucose comes from what we eat. Your body uses it as energy. To get glucose from your blood into your cells, your body uses a hormone called insulin, and think of insulin as a key that unlocks the door to your cells. In type 2 diabetes, one of two things happen, usually both. Your body doesn't respond properly to insulin, or your pancreas can't make enough insulin to keep up with what your body requires. This is called insulin resistance. So instead of glucose going where it's needed, it builds up in the bloodstream. What type 2 diabetes is not. Let's clear something up straight away. Type 2 diabetes is not a personal failure. It's not just caused by eating sugar. It's not something you've given yourself or something that only affects people who are overweight. Genetics play a massive role. So does age, ethnicity, sleep, hormones, stress, medication, and life in general. How does type 2 diabetes develop? Well, type 2 diabetes usually develops slowly. You don't wake up one morning and you're just diabetic. For years, blood sugar can creep up quietly while your body works overtime to try and cope, and eventually the system just gets overwhelmed. Common early signs can include extreme fatigue, extreme thirst, loss of body weight without even trying, loss of definition on your muscles, cramping in your calves at night time, blurred vision, cuts taking longer to heal, or sometimes there's no symptoms at all. And that last one's really important because many people are diagnosed, like I was, during an absolute chance blood test. I was at the doctor's for a different reason. I said, by the way, I think I might be diabetic. Can you please check? And hey presto, I was. Why blood sugar matters. High blood sugar over time can damage the blood vessels and nerves, and left untreated, type 2 diabetes can increase the risk of heart disease, stroke, poor circulation leading to foot issues, blurred vision, nerve damage, kidney problems. But what's crucial is that good management can massively reduce all of those risks. Can type 2 diabetes be managed? Yes, absolutely. Type 2 diabetes can be manageable, and for some people, blood sugar levels can actually return to their pre-diabetic ranges, especially if it's caught and managed early on. Management can include, but is not exclusive to, changes in diet, more movement. That doesn't mean to say you've got to join a gym and go for several hours every day, just movement. Weight loss, if appropriate, medication for some people, insulin for some people, and regular monitoring of your lifestyle and healthier lifestyle choices. So, a final thought on type 2 diabetes. The diagnosis is not the end of your life. In my case, it saved my life. I feel so much healthier because I understand what my body is doing now. It's the start of you paying closer attention to your body and the warning signs and the symptoms. You're not broken, you're not weak, and you're definitely not alone. If you've just been diagnosed with type 2 diabetes, take a breath, slow down, ask lots of questions, and ignore anyone who tries to scare you or shame you because of the condition you now have that you didn't ask for. Also, subscribe to this channel to be notified of similar content as and when it's released that you'll hopefully find beneficial and insightful. I'm the UK Diabetic Guy. Thank you very much for watching.